Hello everyone. Have you noticed that sometimes the clients comes in and discusses all the issue, the complaints that the client is going through, but when you ask them to visualize that particular memory or call for that particular person, let's take an example that you are trying to initiate an empty chair technique, okay, or you are trying to do a psychodrama or a hypnodrama with the client with his parents or with the problem person, right? And the client is able to see the person but is not ready to initiate the communication, or when your client is not willing to see the person or visualize the person. Okay, so what may be the issue? Let's try to understand. It may be wrong to say that your client doesn't trust you totally and completely. Okay, it may not be a rapport issue, may not be a trust issue between you and your client. It may also be a problem that your client, okay, is not ready to face that particular problem. So why does a person willingly doesn't choose to face that problem? Because the ego of the person, okay, is not feeling safe enough to navigate that emotion. Okay, now the first of all, stop trying to blame yourself. Okay, even though you are someone who is like practicing for more than 4 years or 5 years in this field, okay, you're going to face this problem. Even if you are a budding psychologist new to this particular field and you have just started to see clients, and you see that a lot of your clients are not willing to go to the next step. So the first thing you need to do is not to doubt yourself. Understand this, that the psyche of your client is not ready to navigate that difficult emotion again. Okay, that's the first thing you need to keep in mind. The second thing you have to understand is that in order to give them the safe space, you need to identify, is there any mental postulate? What do I mean by a mental postulate? A mental postulate is a belief system, a hardened belief system that has been reinforced because of multiple experiences. So let's take an example. The client is here. I'm trying to initiate a mental dialogue, okay, in an empty chair technique, and the client calls the father, is saying that I cannot visualize my father. Okay, even though the client is is able to look at the father, okay, he is saying that he is not able to see the father. There may be a chances that the difficult emotion pertaining to father is so worse for the client that facing it yet again is going to force the psyche into this unsafe zone. So what should be a psychologist or a counselor's next step? Okay, is to identify, has it been difficult to face your father, and explain your emotions to them. So the client may reply now. So what you are doing is that you are not putting your client in a spotlight, rather you are bringing the platform of empathy where you are trying to understand the space of the client. The client is no more feeling that, okay, I have to do something. The client feels now understood. Okay, so as a budding psychologist or a psychologist who has worked in this field, your job is to sit and create the space of empathy and learn. And then the investigator in you must try to identify what are the postulates, what are the beliefs, that my father will never listen to me. Okay, or every time I show up with my emotions, I'm rejected. My needs are not met by my father. These are the postulates and beliefs that you need to work on first. Okay. Simultaneously, while you are making sure your client processes those emotions in an empty chair technique or a psychodrama or a hypnodrama or any other technique. Okay. So now this has been a prominent question in the last 2 months of discussions with my trainees. Okay, if you are interested in discussing your cases and resistances that you face with your clients, you can always come up to me. You can contact me. Okay, I'm creating a space where I'm interested in listening to all sorts of psychologists, psychotherapists, and counselors while they are dealing with the issues of the clinical and non-clinical clients. Okay, if you wish to have more contents like this, please encourage me by giving me a like or comment in the comment section. Thanks a lot.